Opioids have numerous effects, but how does Narcan alter or modify the effects of opioids on the body? In particular, how does Narcan stop an overdose? Here, the opioid receptor is outlined in pink and shows just a few of the pathways that opioids affect. The two batteries on the cartoon opioid represent the strength of attraction the opioid has for the opioid receptor. This attraction rating is a simplification of the chemical properties between the opioid and the receptor. By counting the little squares on both batteries, we can see that this opioid has an attraction rating of 5. To simplify things even further, let's just discuss the neural pathway for breathing in the brainstem. That's indicated by red here. This neural pathway slows or even stops breathing when exposed to opioids, and the opioid has attached to the opioid receptor, which represents all the opioid receptors on the nerves in the breathing neural pathway. The opioid has slowed breathing and the patient is gurgling and unresponsive. Time to give Narcan. Narcan has a higher attraction rating for the opioid receptor than a typical opioid, and so replaces it on the opioid receptor. Here, we can see that Narcan has an attraction rating of 6 and the opioids is 5. Narcan has special capabilities. Even though it binds to the opioid receptor, its only action is to stop the effect of opioids on the neural pathway. When opioid receptors on the breathing pathway are blocked by Narcan, breathing can resume. Be aware that Narcan will not take care of other types of overdoses, only those caused by opioids. Narcan only works for 30 to 90 minutes, and Narcan now has an attraction rating of 4, as the battery charge indicator shows. So Narcan loses its hold on the receptor. There is a very powerful type of opioid called fentanyl. Very tiny amounts of this drug have powerful and many times deadly effects. In July 2021, the CDC released new provisional data for 2020, showing that 1,024 Texans died from synthetic opioids, excluding methadone, which is the best method for approximating deaths due to fentanyl and its analogs. Remember, you won't know if fentanyl has been ingested. What you may see is that you need more than 1 dose of Narcan to reverse the overdose. Fentanyl overdose can happen within seconds to minutes after taking the drug. Fentanyl has a strong attraction to the opioid receptor, shown here as 8, and a single dose of Narcan, shown here as 6, may not be enough to clear the receptor and stop the overdose. After waiting 2 to 3 minutes after the first dose, the second dose of Narcan is given, and then has enough attraction to the receptor to overcome fentanyl's bond. Narcan again loses the ability to hold on to the receptor after 30 to 90 minutes, and because of fentanyl's relative strength, it can again bind with the breathing pathway receptor and slow or stop breathing. Many illicit or street drugs contain synthetic opioids like fentanyl, or drugs that are chemically similar to fentanyl called fentanyl analogs. Because a variety of drugs may be combined with fentanyl or fentanyl analogs, even the user may not know what is being used. Understand that we simplified this discussion to talk about only one neural pathway, the respiratory pathway controlling breathing, but actually, all the neural pathways that have opioid receptors are affected by opioids and by Narcan. Narcan blocks the effect of opioids on euphoria, digestion, itchiness, and all the rest. Because of this, an opioid-dependent person may begin to feel very uncomfortable when given Narcan after an overdose. They may try to leave, and they may try to find more opioids. If you can, gently encourage them to wait for help, to enter treatment, and to know that outpatient programs offer the promise of harm reduction for better outcomes. Getting them to the hospital starts this process. This will definitely help the patient. Remember, the goal of Narcan administration is to allow the person to breathe again, not to become fully alert. If breathing doesn't return, if the person needing help remains unresponsive, the best treatment is to start CPR. Knowing how to use Narcan and knowing CPR can save a life.